Every year, twice a year, we move the clocks. And every year, the conversation is the same. People typically just complain about being tired for a few days around daylight savings time, crack a few jokes on social media, grab an extra cup of coffee at the office, and then move on. But what typically doesn't get talked about enough is what's actually happening from a physiological perspective inside of our bodies during that window.
What's up, and welcome to Sam Science, where you're joining me just over a decade into my personal journey of working to bridge the gap between metabolism, macros, muscle, and medicine, all while helping coaches scale the impact that they desire and deserve. If you are here, thank you so much for listening and for trusting me to help you elevate your coaching game or to lead you in your transformation to realize your true potential. In either case, each week I'll be sharing my methods, models, and message to serve as leverage for your specific goals. Without further ado, let's get on to today's show.
Because when we actually look at the research and not just people's stories of being tired, the actual published literature reveals that daylight savings time, especially the spring shift, functions as a population scale circadian disruption event. And the downstream health effects show up very clearly in the numbers, from cardiovascular implications, strokes, fatal car accidents, and even workplace injuries. Or for those of us who are focused on our physiques and metabolic health, there's plenty of metabolic dysregulation happening. And this isn't just theoretical risk. In the days that follow daylight savings and the clock change, we see this consistently across multiple countries and data sets. I want to spend some real time on the actual statistics because they're worth understanding, not just so that you have some random fun facts to regurgitate or to win at trivia, but because they're very applicable to how you manage your health. And if you're a coach, you can use this to support your clients through this window every single year that we push the clocks forward or set them back. So today we're going to walk through the research and what actually happens when we spring forward for daylight savings time. So we're going to start with the most serious end of the spectrum, and that's related to our heart health. So a 2014 study published in Open Heart analyzed hospital admission data from Michigan and found a 24% increase in heart attacks on the Monday immediately following the spring daylight savings time shift. So just that one particular day, the Monday following the Sunday daylight savings time, we had that increase. A separate analysis of Swedish registry data, so not just in the United States, found a 5% increase in heart attack in that first week after the transition. Now, already there's more heart attacks on Mondays typically, but a 5% increase is not a small number when we're looking at population data, and a 24% single spike warrants more than just a passing mention. The fact that this has been shown in both US hospital data and Scandinavian registry data, two very different populations and two different research groups, makes it pretty hard to dismiss. The mechanisms here aren't mysterious. Acute sleep deprivation elevates sympathetic nervous system tone, impacts cortisol, which already peaks in the morning as part of that cortisol awakening response, but this becomes misaligned with the actual clock time when we set the clocks forward. So when you're getting that cortisol surge at a point that doesn't just match your typical morning, blood pressure can also increase, and the lack of sleep can cause inflammatory signaling to rise. It's clear that this recipe is not a great combination, and the cardiovascular system is not particularly forgiving when these variables collide. A 2016 Finnish study published in Neurology found an 8% increase in stroke risk the first 2 days after the daylight savings time transition. The higher risk populations were older adults, cancer patients, and individuals with existing metabolic issues, which makes sense because those are populations with the least physiological buffer when this circadian alignment starts to break down. When you're already trying to manage or mitigate inflammation, there's high blood pressure, compromised metabolic function. These individuals were definitely already at risk to begin with, but a forced circadian shift adds insult to injury, and it really doesn't take much to tip the scales in these cases. Now, let's talk about the implications of sleep loss at scale, not just in terms of heart and neurological factors. Most people don't adapt to this spring shift quickly in a day or two. The average sleep loss on the first night is somewhere between 40 and 60 minutes, and measurable sleep disruption continues for 5 to 7 days. Sleep fragmentation also increases, meaning even in the hours that people are sleeping, they're often getting lower quality sleep. Sleep disruption impairs glucose tolerance, and that means impaired insulin sensitivity. It disrupts our appetite hormones, so don't be surprised if people may be deviating from their nutrition plan. Leptin tends to go down, ghrelin goes up, and this also impacts the cortisol rhythm, which is already getting pushed around with the clock change. And this tends to further dysregulate sleep. And then people reach for more caffeine, and then that'll make sleep worse as well. Now, if you've listened to the podcast for a while, you'll know that I talk about sleep as a cornerstone of metabolic health. The quality, the timing of your sleep, it impacts how you handle glucose, and it even impacts how your hunger signals behave. Sleep is one of the best ways to be more resilient to stress is getting a good night's sleep. But when you compress or fragment sleep in the context of this circadian shift, you're not just tired, you're dealing with some metabolic implications on top of being tired. So if you have clients who can't explain why their energy crashed, or it feels like their workouts are off, or maybe their hunger signals are a little bit different this week, it could just be part of that daylight savings time story. Now, we don't want to make this a scapegoat either, but it's just important to be aware of the data and the health implications. Now, it's not just limited to heart health. It's not just only limited to insulin sensitivity or inflammation. There's actually accident data that's population wide that's consistent and worth knowing. This is both in terms of car accidents and even occupational hazards. One US analysis found approximately a 6% increase in fatal car crashes during the week after the spring daylight savings time transition. The contributors are straightforward. Sleep deprivation impairs reaction time and vigilance, which impacts decision making, which is considerably important, especially when you're operating a motor vehicle. On the occupation side, in the workplace, a study that's been cited fairly widely in this space found a 5.7% increase in workplace injuries following the spring shift, with 68% more lost work days per injury, meaning these are more serious injuries. The second number is definitely more telling. It's not just that injuries are happening, it's that the injuries that do happen tend to be more severe. That's consistent with what we know about how sleep deprivation impacts physical coordination and the quality of decisions that people make, and like we said, the reaction time in the moment before an injury occurs. Sleep deprived people make worse decisions and have slower physical responses. That's not a controversial claim. It's actually pretty well supported by the research. The daylight savings time transition just creates a moment where that's happening across the human population, or at least all countries that participate in daylight savings time. That's happening the same week on the same roads in the same workplaces because a lot of people are fatigued. Now, this fatigue and sleep implication can also impact mental health. Now, the mental health data may not be as alarming or dramatic in terms of the absolute headlines or news stories that you would see, but it's definitely worth naming. There's evidence of increased depressive symptoms, lower mood scores, elevated irritability, and more in the days following the spring daylight savings time shift. Some data sets have shown a higher suicide risk, but it's super hard to isolate that in terms of causation versus correlation. And we certainly don't want to overstate it, but suicide is worth talking about. When we have the circadian misalignment as a result of daylight savings, this disrupts serotonin regulation. Sleep deprivation then compounds any existing mood instability. Then the cortisol misalignment that we talked about earlier affects people's ability to regulate their emotions, and this is pretty well documented in most sleep research. When your cortisol is peaking at the wrong time relative to your wake time, your stress response is essentially miscalibrated from the moment that you get up. If you work with clients who are trying to manage their mood, or they're navigating anxiety or any kind of mental health history, the week after the spring shift is worth flagging proactively. It's not something, again, I don't want this to turn into any type of catastrophe or scapegoat, but it's just a situation where our baseline health may be a little less stable than usual, and normal coping strategies may require a little more intentional support. The clients who benefit the most from that kind of heads up are usually the ones who would never think to connect having a rough emotional week to the clock change and daylight savings. Now, let's talk about metabolism, because that's kind of the name of the game here. This is one area that I think gets the least attention relative to how significant it is in terms of our health. Short-term circadian disruption has been shown to impair insulin sensitivity and glucose tolerance, even in otherwise healthy individuals, meaning these are not overweight or obese people. Some studies have shown a single night of reduced sleep can decrease insulin sensitivity by 20 to 30%. And that is just with a night or two of compromised sleep. And the spring daylight savings transition is not just one night of disruption. Again, people are typically impacted about 5 to 7 days where they're experiencing degraded sleep quality in the context of their circadian rhythm that's being forced forward. The spring shift tends to be consistently more disruptive than the fall shift, since we're springing forward an hour instead of falling back. And the reason comes down to how human circadian biology actually works. Our internal clocks tend to run a little bit longer, slightly longer than those 24 hours that people who made clocks and the 24-hour day operate by. So it's working against that biological tendency. The cortisol awakening response becomes misaligned with the actual wake time. The fall shift moves the direction the body already wants to go in most cases. It's not painless, but it's fundamentally different in terms of what it's doing in terms of our sleep and wake times. The spring shift essentially forces temporary social jet lag. And unlike actual jet lag, where you choose to get on a plane and you're aware of the adjustment you need to make, most people walk into the spring daylight savings time shift without any preparation, and then they wonder why the entire week feels off. So let's talk about what you can actually do to help prepare for the next daylight savings and just how to balance this, knowing that it's something that happens every year. Light exposure matters most during this window, now more than most people realize, and especially compared to other parts of the year. Getting outside within the first 30 minutes of waking, even on a cloudy day, helps to anchor your circadian rhythm to the new schedule faster. The photoreceptors in your eyes that communicate with your suprachiasmatic nucleus, the brain's master clock, are sensitive enough to even diffuse outdoor light, even on a slightly overcast morning. Now, this is going to be more effective than any indoor lighting. I see way too many influencers on Instagram saying they're getting morning light and they're basically inside, but like looking out a window. So please go outside if you can. This is going to help with that diurnal rhythm and hopefully get you feeling better faster. In the days leading up to the spring shift for next year, make sure you slightly adjust those wake times, maybe 15 to 20 minutes per night into the subsequent morning. Most people don't do this because they don't think of daylight savings time as something that requires any preparation. They treat it as an inconvenience when it happens, but really thinking about it reactively. Given what the research reveals, it's worth treating it a bit more seriously than that. Alcohol and caffeine are two substances or ingredients where we're going to need to be more conservative during this window. Both are going to disrupt sleep architecture, and this is something that's already being impacted by the time change. This is an adjustment period where your system, think of it as like my internal health, my physiology, has a little bit less margin for error on this week. From a metabolic standpoint, and just in terms of your training and exercise, this is not the week to be crazy aggressive with like pushing calories into a surplus or high intensity training volume. Your insulin sensitivity is already a little bit compromised. Your recovery could be impacted by the lack of sleep. So if you're sleeping great and you feel good, like keep training through it. That's fine and encouraged. But managing the overall load across the week is pretty smart just to avoid injuries and things like that. So if you're a coach and you have a client in a hard training block, the week after the spring shift actually is a pretty reasonable time for a slight deload, or just monitor recovery markers so that we're not risking injury. So also, if you are a health coach, this is a practical opportunity to get ahead for your clients. So as you move into check-ins this week, if you're listening to the podcast, give clients a heads up like, hey, if you're feeling a little tired or any different, hunger cues, this is what happens as a result of changing the clock. This is what separates coaches who are actively managing their clients' health from coaches who are just responding to problems after they've already happened. Your clients aren't going to directly connect a rough week of mood or hunger or cravings or energy to a clock change on their own. That's your job, and you can help them understand the implications of daylight savings. Now, daylight savings time is a policy decision from the government that was made for reasons that have nothing to do with human health. The research on what actually happens and what it does to the body has been accumulating for years, and this is something that's worth taking seriously, especially if you care about your health or the health of your clients. The population level increases in heart attacks, strokes, car accidents, workplace accidents, and metabolic disruption are real, and they're documented in research. Most people get through it just fine, but most people is a statistical statement. It doesn't tell you anything about the individual sitting across from you or about your own physiology in that window. It's not like most people are taking blood sugar readings every day after daylight savings. So most people just aren't aware that these problems are going on. If this was useful and you enjoyed this episode and you want more people to understand the science and implications of daylight savings for our metabolic health, please share this episode and make sure you're subscribed so you never miss an episode. If you're interested in learning more about practical coaching scenarios and understanding the deeper insights related to metabolic health, that's exactly what we do in our functional nutrition and metabolism specialization program. You can learn more about that in the show notes. If you're on audio, leave a 5-star rating and review. If you're on YouTube, make sure you hit subscribe and hit that notification bell so that you never miss an episode. Comments on the episode always are appreciated and help to support the show as well. Remember that when you listen, when you download, when you subscribe the show, it helps to show the content to other individuals who are similar to you and have that shared interest in wanting to improve their own health and the health of humans around the world. I appreciate you guys tuning in to each and every episode, and I will talk to you in the next show. This show is designed to help you translate complex nutrition, fitness, and physiology concepts into leverage for your clients' goals or your own personal goals. This podcast is for online education, meaning this podcast is for general informational purposes only and does not constitute the practice of medicine, nursing, or other professional healthcare services, including the giving of medical advice. And no doctor-patient or coach-client relationship is formed through listening to this episode. The use of information in this podcast and the show notes or the reliance on the information provided is done at the listener's own risk. The content of this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment, and is for educational purposes only. Always consult your physician before beginning any exercise program, and users should not disregard or delay in obtaining medical advice for any medical condition they may have and should seek the assistance of their healthcare professionals for any such condition. By accessing this podcast and any other episode, the listener acknowledges that the entire contents and design of this podcast are the property of Oracle Athletic Science and should not be used or retransmitted without permission of Oracle Athletic Science. This is protected under U.S. and international copyright and trademark laws. Except as where otherwise provided herein, users of this podcast may save and use the information contained in this podcast only for personal or other non-commercial educational purposes. No other use, including without limitation, reproduction, retransmission, or editing of this podcast may be made without prior written permission of Oracle Athletic Science and Sam Miller, which may be requested through the contact information in the show notes. By accessing this podcast, the listener acknowledges that Oracle Athletic Science makes no warranty, guarantee, or representation as to the accuracy or sufficiency of the information featured in this podcast, and coaches and listeners understand that this information may change over time with different research and anecdotal practices in the field. It is the listener's responsibility to stay up to date on this information. As always, this show is designed to help you, and I appreciate you listening to every episode. Simply understand it's for general informational and educational purposes, and we'll talk to you in the next episode.